Welcome to this video on Ramadan, fasting, and diabetes. We will explore the challenges and safe management strategies for people with diabetes during the month of Ramadan. Ramadan is the 9th month of the Islamic lunar calendar and is a sacred time for Muslims worldwide. Fasting during Ramadan is one of the 5 pillars of Islam, making it a central act of worship. During Ramadan, Muslims fast from dawn until sunset, refraining from food, drink, and other physical needs. It is a time for spiritual reflection, self-discipline, prayer, and increased charity. For people with diabetes, fasting during Ramadan carries risks such as low blood sugar or hypoglycemia due to long fasting hours. High blood sugar or hyperglycemia and ketoacidosis can result from missing or reducing insulin. Dehydration is also a risk. The risk of fasting in people with diabetes can be assessed using tools like the International Diabetes Federation Diabetes and Ramadan Alliance, or IDF-DAR, Fasting Risk Assessment Tool. This tool helps classify patients into different risk categories to guide safe fasting decisions. The IDF-DAR tool assesses factors like the type and duration of diabetes, the risk of hypoglycemia, the level of diabetes control and treatment, medication risks, and overall physical health and existing complications. Management considerations begin with assessing if a patient is safe to fast. If fasting is unsafe, it should not be encouraged, as Islamic teachings allow exemptions for those whose health may be harmed. Patient education during Ramadan is key. Teach patients to check their blood glucose, as this does not break the fast. All calories should be shared between the pre-dawn meal, suhoor, and the sunset meal, iftar. Diet should include low glycemic index, high-fiber carbohydrates, maintain a balanced intake by limiting sugary and deep-fried foods, and use healthy fats like olive or rapeseed oil. It is important not to skip suhoor. Avoid caffeinated and sugary drinks, as they increase dehydration risk, and limit dates to 1 to 2 maximum due to their high sugar content. When it comes to exercise, avoid strenuous activity, especially near sunset, to reduce the risk of hypoglycemia and dehydration. Remember to always have your pre-dawn meal, suhoor. Patients should not fast or should break the fast if their blood glucose is less than 4 or greater than 16 millimoles per liter, or if they experience symptoms of hyperglycemia, dehydration, or acute illness. Symptoms of hypoglycemia or low blood sugar include sweating, shaking or tremor, dizziness or confusion. Symptoms of hyperglycemia or high blood sugar include excessive thirst, frequent urination, fatigue, or blurred vision. For metformin, no dose adjustment is typically needed. If taking once daily, take it with iftar. Twice daily, take it at suhoor and iftar. As usual, prolonged release, take it with the evening meal. If taking metformin 3 times daily, take the morning dose at suhoor. Combine the lunchtime and evening doses and take them at the evening meal. Sulfonylureas carry a higher risk of hypoglycemia during fasting, so switching to an alternative is preferable. For once daily dosing, take it with iftar. For twice daily dosing, take the usual dose at iftar and reduce the suhoor dose by 25 to 50%. For DPP-4 and SGLT2 inhibitors, no dose adjustment is usually required and medications can be taken with iftar. However, encourage increased fluid intake during non-fasting hours, especially with SGLT2 inhibitors. For once daily basal insulin management, take it in the evening iftar and reduce the dose by 15 to 30%. If taking twice daily long-acting insulin, take the usual morning dose at iftar. Take the evening dose at suhoor, reduced by approximately 50% to help lower the risk of hypoglycemia. For short-acting or rapid-acting insulin, take bolus insulin with iftar, adjusting the dose as needed. Omit the midday dose. At suhoor, reduce the dose by up to 50%. Adjust doses based on blood glucose readings. If taking pre-mixed insulin once daily, take the usual dose at iftar. If twice daily, take the higher dose at iftar and reduce the suhoor dose by up to 50%. For 3 times daily, omit the afternoon dose and adjust the suhoor and iftar doses. For dose titration and safety, the target pre-meal blood glucose is between 5 and 8 millimoles per liter. Dose adjustment based on pre-meal glucose. Reduce by 2 units if glucose is 4 to 5, and by 4 units if less than 4. Increase by 2 units if glucose is 8 to 11, and by 4 units if greater than 11. Remember to break the fast if blood glucose is less than 4 or greater than 16, if there are symptoms of dehydration, or if there is an acute illness, vomiting, infection, or pain. Fasting is exempt for certain patients in Islam, as it is permissible to break the fast for health reasons. Patients may seek further guidance from local imams. Thank you for watching this video. Please like, share, subscribe, and turn on notifications.